HIV has been around for 40 years and the first treatment was made available about 30 years ago. We've come a long way in terms of treating HIV. Science has delivered a revolution in how this disease is treated. And today, if you are living with HIV, your life expectancy is the same as somebody who's not living with HIV. But what has not changed is stigma. So at a global level, this is a highly stigmatized disease, whether it's in the developed countries where it is mainly a disease of men who have sex with men, transgender women, to sub-Saharan Africa, where it's a virus that impacts more than anybody, young women and adolescent girls. Or whatever population you are in, we need to make sure that we are fighting stigma. We're still seeing about 1.7 million new infections a year. And so what we really need to do is to continue, obviously, to innovate, to drive access forward. But we also need to make sure that we're working in partnership with funders, that we're investing in prevention, and that we are bringing together strong partnerships at a global level. ViiV's mission is to leave no person living with HIV behind. We're the only company in the world that is dedicated to this single disease area. We are 100% dedicated to the discovery of new medicines to both treat HIV and also to prevent HIV. So we work in partnership with the medicines patent pool and generic manufacturers to make sure that we are issuing voluntary licenses for our innovative medicines. There are about 28 million people today who are taking an HIV medicine, and about 22 million of them are taking one of our innovative medicines, and that's because we've been able to partner with generic manufacturers to provide very low cost access.
The partnership between Medicines Patent Pool and ViiV Healthcare started back 10 years ago. That's when we signed the first agreement for an HIV treatment. By the end of 2022, there were an estimated 21 million people on HIV treatment through that MPP ViiV Healthcare license. We reached more than 100 countries accessing first-line HIV treatment as recommended by the WHO, and also there were 73 countries already accessing a very special pediatric formulation of that same product in just 1.5 years or 2 years after launch. So that's really quick and really building on the power of that partnership.
So if we have a desire, which we share with all of our partners, to end the epidemic, no one entity can make this happen. Partnership is absolutely crucial. So we work with NGOs, we work with civil society, with the community, with healthcare providers, with governments, and we come together to really focus on the steps that we need to take, both to ensure that there is access to the treatments that are available for HIV, but also that we're very much focusing on prevention.
AIDS is a Dutch organization. We work both in the Netherlands and on an international level. And we want to have a world where everybody can love freely and without fear. Our dot on the horizon is getting an HIV cure available for all people living with HIV. And in the meantime, we do our very best to support communities, to prevent new HIV infections, to reduce AIDS-related deaths, and to improve the sexual health and rights for all. Well, ViiV Healthcare, we are in the Pediatrics Partnership, Breakthrough Partnership Program, which is very important to us as children are being left behind. They don't have a voice on an international level. I think one of the key strengths of our HIV movement is that communities are very strong in organizing themselves, establishing organizations, speaking on behalf of the communities to represent their needs, what they need in terms of funding and resources. But children don't have that voice. They can't organize themselves in organizations. And that's why AIDS funds, together with ViiV Healthcare, need to step up and represent those children living with HIV and ensure that AIDS ends among these children.
Mothers to Mothers was founded in 2001 in South Africa to prevent the vertical transmission of HIV. The idea was incredibly simple. that the person best placed to support a woman newly diagnosed with HIV was someone who was actually on the same journey, who was themselves living with HIV, who comes from the same community and who understands the context of their life. Fast forward 20 years and we've virtually eliminated vertical transmission for our enrolled clients for 8 consecutive years.
I'm working with Mothers Uganda as a community mentor mother. My role is to teach them on what to do to live a happy, healthy life. It was one day when I came for my appointment, when they introduced me, a mentor mother, she mentored me so that I started suppressing. By the time I conceived, I came to her, I talked to her, she told me what to do. And when I gave birth, I brought my baby, she was negative. He said, Winnie, you know, you're making me good, you're making me happy, I'm feeling that I'm working. And even you can support others, why not?
HIV is an incredibly tricky virus. It mutates, it evolves over time, and what we have done together through science, through talent, and through technology and incredible partnerships is stop that virus in its track. Science is amazing because it allows us constantly to move forward the impact of our treatments and our preventative medicines to really ensure that we are focused on limiting the number of new transmissions every single year. We work then in partnership with healthcare providers, with academic scientists to ensure that we're thinking what is the next step forward that we want to take from a treatment and from a prevention perspective. We've made significant progress over the past 30 years, from 1988 all the way through today, to a situation where you can, by taking one pill a day, live your life with HIV. And we're particularly focused on prevention. We can only do it through partnership. We need to work with partners to ensure that there's access at a global level, and that is how we will end the epidemic together.